Welcome to the office. What brings you?
I have chronic pain in my jaw. I want to say it's this side, but I feel like they both probably have.
You're here for TMJ?
Something to do with it, yes.
When did this start?
4 to 5 years ago, I want to say.
What happened 4 to 5 years ago?
I don't know. Nothing significant. No, like, actual traumas. It's just, I've always been like a chronic cheek biter, and so I feel like maybe
Hold on, let's rewind. Chronic cheek biter means what?
I was constantly biting my cheeks. So I constantly was shifting my jaw. Maybe that contributed to it.
Since when?
Childhood.
Since when? Childhood means 3, 5, 10?
7, 8 years old.
And you remember?
I was constantly biting my cheeks and my nails, viciously. It was anxiety that I had as a kid.
From
and
what?
Persisted into adulthood. Generalized. Just generalized anxiety.
Who told you that?
My doctor who prescribed me sertraline.
Are you on it right now?
Yeah.
Okay. For anxiety?
Yeah.
Okay.
It helped significantly. And then
okay.
I wanted to stop the cheek biting because I thought, okay, that's the last thing that I need to do to help with my pain. So I got masseter Botox, and that stopped me from cheek biting. So I'm like 7 months clean of not biting my cheeks, and it's still getting worse. So
what's getting worse?
The pain in my jaw and how fast it starts to hurt. Like I used to be able to make it through a meal and be fine, and then maybe by dinner it would hurt. But now it's like 3 bites into anything that I eat, I'm like...
You're feeling it on the right first?
Right.
On the left as well?
On the left as well, but even when I had masseter Botox, this side was a much bigger muscle.
Masseter Botox?
Yes.
What does that mean?
She injects Botox into the muscle, and it weakens it. And also
well,
it made
kills the nerve is what it does.
Oh.
You do know what Botox does.
Botulism, yes, it freezes it. I just know that it freezes the muscle, right?
It kills the nerve to the muscle.
So
that's Botox. Can I see you open your mouth? And close. Now let's do this again. Slow. Right. The left side comes out first. Right side is your compensation. It's your left TMJ, remember, right?
Mm-hmm. It's just what I'm hearing.
That's the compensation. I will explain that. So, and I'll explain it right now, actually. So when we're looking at the TMJ, the side that it deviates away from first is the problem side. And what the body does, it's going to compensate. The compensation is that EX component. It's popping out, so it's popping because it's compensating. But the issue is actually this side. Now, in this work, TMJ is the one exception where we would work on the compensation first before the actual problem. And the question is that predisposed from an upper cervical? We're going to find out on the x-ray.
Okay.
Okay? All right, and you've been dealing with this how many years, you said?
4 to 5.
4 to 5 years. The cheek biting, though, goes back further.
Way further.
You don't remember having jaw deviations as a kid?
No, I never had braces. I did do Invisalign, though, and...
But you were biting your cheek.
Yeah.
That tells me something.
Yeah.
That something was off back then. Sports as a kid, what did you do?
I had a trampoline in the backyard, and I would just jump on the trampoline, but no injuries. I never broke a bone or had anything significant happen like that.
Okay. All right. Okay. What else? Back, neck, anything else?
Neck, oh my god. Well, as my job, I'm a makeup artist, so I constantly, yes.
Okay, so you're a makeup artist.
I'm a makeup artist,
And you've been doing this for how long?
About 8 years.
Okay.
Full time.
Very cool. Here in LA? Okay. When you're doing makeup, is your TMJ bothering you when you're communicating with your clients?
Yes, and I notice it on the way home when I'm like so fatigued from having to have customer service interactions all day and tell my life story because everybody wants to know. So I do a lot of talking on the job and explaining. And also being like this for a long period of time, it kills me right here. And that's where I usually have massages focus on, is underneath my rhomboid, or the rhomboid muscle.
Okay.
And I get a little relief, but not much.
Okay. That's it?
That's like my chronic pain areas. I don't really have too much other overall pain.
Okay. You know what I do here?
Yes.
We're going to look at everything.
Yes.
Okay. First thing we're going to do is we're going to look at your films. I'm going to explain what I see, then we're going to do the exam, figure out where we're going to start. Okay? Along the way you have questions, you ask.
Okay.
You're uncomfortable with anything, say stop.
Okay.
Okay?
Understood.
And you're okay over there? Awesome. let's go over your x-rays. Let's see what we got. This is you. This is a picture in time. This will tell me kind of how you've evolved since birth. We have 24 bones in the spine that move, 23 discs in between. And the way we're looking at this is like a 24-story building. The foundation of the building is the pelvis and the sacrum, yeah? And if we're looking up here, we can see there's a little bit of deviation of the spine. You're kind of tilting to that left, and that's kind of looking like your habit of your work. Yeah. If you think about it, you're leaning to that left,
Always.
yeah? So it kind of deviates this way, comes up over here, and then what does it do over here? It kinks out. Okay, and we're going to go in a lot of detail. Let's start first with the foundation. Because you're complaining up here in the penthouse. Yeah. But we got to look at the basement. And what do we see in the basement? We see a little bit of imbalance on the right hip. Yeah? Let me put the numbers up. It'll make more sense. Let's go ahead and do the analysis. Top of the iliac crest. Sacroiliac. S1 tubercle. Sacral. Lateral border of the sacrum. Top of the femur head. Center of the pubic bone. Ischial tubes, and voila. Alright, so this is what we have going on, okay? So a few things. We have a rotated sacrum on the right. We have a rotated pelvis, and we have a slightly short leg on the right. Now follow my process for a second. Sacrum, when we're looking at it, is doing this. It's going back. Okay. When we're looking at the pelvis, the way the pelvis works, it works in opposite. One goes up, the other goes down, one goes in, the other goes out. Yours is actually misaligned up, okay? It's up and in, and the sacrum is back. But it's down on the hip side here. If I work on your pelvis, guess what happens? I'm going to make your imbalance more. So the answer is not there in your foundation. The answer is we got to work on the sacrum, okay? Now, it's a 4MD. If we can get that up 1, 2, that's fine. It's still under 7 millimeters regardless of whatever it is. As long as things are under 7 in the femur head height difference, adjustments will hold. So there's no issue there, okay? Now, that's your foundation. So we're going to figure out where we're going to start there. Now let's go up and let's follow the process from the foundation. We see it's down on the right, but then it's compensating going to the left. It goes up lumbar spine to around the mid-back, actually higher up, to about here. And then from here it levels out, but then it does it again. And now we get to the TMJ. So the reason I just bypass it is there's nothing too exciting there for me. It's kind of all just compensation from posture, it looks like to me, okay, right now. Megan Blasi in digestion. Megan Blasi could be a little cleaner. We'd like to see a big black half circle here. Yours is right there. Should be a little bit bigger, and for your age I would expect it to be a little bit bigger. Digestion is okay though? No issues with digestion?
Sometimes I have issues with digestion.
Meaning you're not, is it a bathroom issue? You feel bloated? You feel...
I get a lot of bloating, but it's around my cycle, so I just blame it on my cycle. And I am on my cycle right now.
Got it. Okay. All right. So we'll see how that does over time. Now, left shoulder is also an issue. Your left shoulder. When I'm looking at the shoulders, here's what we'd like to see. So when we're looking at the scapula, this is part of, I believe, the work. You can see when we're looking at the scapulas, the first thing we're looking at is, I'm looking at the overall shape here. Is it symmetrical here and here? This should be a elliptical shape. This is the glenoid fossa. We have what's called a teardrop shape. This side is also, and then when we're looking at the head of the humerus, there should be a space all the way through. You can see it's higher up. It's not really higher up, it's an x-ray projection. And what it's telling us, which is part of the work again, we have the anterior, but the left is worse. And it looks like it's jammed up high. It's not that, it's because it's more anterior than the right side. So I'll work on your shoulders too while you're here, okay? Okay. All right, now let's get to the TMJ. So when you open your mouth, close. Slowly open. Left side opens up first, right side compensates. And if we look here, it's a little misleading here, right? And the reason it's misleading is because it gets stuck in one part. And I did two TMJ, I did two x-rays, remember? And I did it for a reason. This was the first one. Okay, and let's put up the second one to see what the difference is. So this is the first one, this is the second one. And I'm going to switch it for just 1 second, okay? Bring that over here and that over here. So when you first open, see, it doesn't make sense, dude. When we look here, this is your right side. So this is your right side. And this is the first part of you opening your jaw. Sorry, I'm just getting used to that. Alright, let's see. Okay. So this is what's... I first had you open. Now this is the right side, we said. So what it looks like here is that the right side is the problem when you first open. But just now when you're doing it, come, stand over here. Turn this way. So let's look and see. Look straight ahead and slowly open. Which side comes out first? Close again, close. Watch my fingers. And we're looking at the deviation of the symphysis mente. It's coming out here first, isn't it? So it's a little misleading because so the left side comes out first. But on the first part of the x-ray, what does it show us? It shows that this is thin, this is thicker. I'm looking at this. Because when we're looking at the x-ray, we're looking at the wider side is the EX side. Okay? So if we look there and we look here, this is the wider side. If we do it over here, I mean, it's kind of subtle, right? So it's a little confusing. We're going to figure it out in your exam, hopefully. Okay, so the exam tells us the left is the compensation, that's the subluxation, that's the compensation. The x-ray tells us the opposite. So here's a good lesson number 1. If you're looking at the x-ray and the patient, what do you go with? The x-ray or the patient? The patient. Okay? We'll see what happens with that. That's interesting. That was an interesting finding. Okay, let's continue. Okay, on the lateral, we're looking at the posture. And when we're looking at the posture, what we can see is curve and posture. Curves are fine. Your curves are good. Your low back curve is good, mid back curve is good. However, you can see that this line, we want the posture plumb line to go through 7 here. So what it's showing us is you're slightly behind the foundation. That's why when we're doing your x, you want to make sure you weren't pushing yourself back. Okay, you weren't. Okay, so part of this muscle tension here in the work and everything you're doing is what? You have the rounded shoulders, but you're also back like this. So this is all tight.
It always is.
Okay, so there are a few things we'll go over down the road in addition to your adjustments. And we're going to see a couple of visits, and then you'll decide what you want to do from there, okay? And get some answers today. But that was actually kind of misleading to me. Good. All right, let's continue. Tailbone. Tailbone's fine there.
Literally a tail.
It's literally a tail. We have a little nub here. Maybe there's something in the sacrum. We know there's a rotational component. Actually, S2. S2 is where we're going to find it, rotated on the right. Okay, discs are good. Discs are, I want you to see this now, and this is another answer. You see how you see the circle patterns here, the bones here? So they're going all the way up, aren't they?
Yes.
That's all compensation to the tailbone, the sacrum. 5, 4, 3, 2, 1, 12, 11 levels out. So everything from T12, L5, all this is compensation to your foundation.
Wow.
12 levels off. Now, if we go back here, 5, 4, 3, 2, 1, 12. So 12 levels it out, then 11 comes back. 11 is the next one out. So T11, sacrum. You know, for me and the Gonstead docs, it's about the analysis, guys. Once we get the analysis, then Then the fun starts.
So thorough.
So here's what I want us to kind of see here, okay? We said 12 levels. 11, ooh, this is 11 goes off. I want you to see this. Big pedicle, small pedicle.
Yeah.
Big pedicle, small pedicle.
Mm-hmm.
Big, small. Big, small. Kind of switches. Big, small. Big, small. Do you see that?
Mm-hmm.
Evens out again. That's your culprit right there. 1, 2, 3. T4. Ah, T4 is your neck, and your TMJ is where it starts at T4. T4 is your heart, lung, heart chakra. That's that anxiety that you were dealing with as a kid. But here's the cool part. I'm going to give you a little fun fact. One physiological difference between anxiety and excitement. One physiological difference. The breath. So everybody that comes in, it's 95, 90% of everyone got some anxiety. We got to do breath work. I'll give you some recommendations, okay, in terms of some yoga breathing techniques. You've got to start doing it.
I have been.
You have.
It's been like recently I've been meditating like as much as I can, like once a day at least. Or
that's not. I'm talking about breath work, specific breath work, and diaphragm breathing. Okay, like if I say take a deep breath in right now, take a deep breath. You see how she's raising her chest? That's not how you want to breathe.
Through your stomach.
You want to breathe. You're going to take a deep breath in. You guys will practice together. I'll work on it with you guys later, okay? That breath work is key. And especially when it happens. You see it, get her to breathe. There's also a couple of trigger points, or pressure points. I'll show you guys that stuff later, okay? T4. T4 starts that process. T4, all the way up. And then let's look at the upper cervical. Of course she has a critical. Of course. So we have T4, critical atlas, and foundation. And T4, 411, foundation, critical atlas. Your C2 is wedged on the left. Your C1 is wedged on the right. It's doing this. It's like the Jenga, right? So we're going to have to, if it shows up, of course, we're going to set 2 and 1 to open up this upper cervical mechanism and check the jaw after all that. Okay? And in your case, let's see what we find. So we have foundation, we have 11, we have 4, and we have upper cervical. These are all potentials. Last thing I want to do is see flexion. Remember I told you I wanted to, because when I looked here, right there, there's a space, there's no space there. There should be a space there. That space is between the occiput and the atlas. Okay? I don't see a lot of space there. There should be a space. So I had you do flexion. Yeah? Yeah. And in flexion, what happened? It didn't really open up. Oh. So you have upper cervical trauma. Mama dropped you, they're not telling you. Mama, you dropped it. Fess up. I'm telling you, if you're telling me you don't remember trauma, that's a fall on your head, dude. Someone dropped you. Look at me. I'm not joking. I joke, but I'm not joking. I don't joke about that. Yeah. That should open up. You're telling me you had no trauma. You better ask mom or dad, whoever's there. Okay? Let's get started. Have a seat in the chair. Okay, so let's take overall look. And yo, yes, I need that up. Okay. So first thing I want you to see is, I don't actually even see her dimples, dude. I should be seeing some dimples here. Yeah. This is inflammation. No. Okay, number 1. Number 2, you look at the spine, so there's nothing here. This is all swelling. You start to see the spine here, right? But then it stops. Check it out. Then right around T7 you have what's called dishing. If you want to see from the side, T7, it dishes, it goes in, it doesn't come out. Okay? On the x-ray you don't see that part. You see it here. So I'm sure we're going to find something around T7 that creates that dish. You see what I'm feeling right here? It's going inward instead of coming out. It should be coming out a little bit. Follow my process now. So, swelling. I can see the spine now. From here, 7. It dishes, it disappears. I don't know how you see that without looking at the body. Now, stand up for me, please. Face the window. March in place. March in place. Follow me. March in place. Nod your head. I'm right behind. I'm right here so you don't fall. March in place. Nod your head. Close your eyes, please. Close your eyes. You're going to keep marching. Now stop marching and nod your head. Keep nodding. And then I want you to stop where you think your eyes are level with the horizon. Okay? Where you feel straight. Now, what do you see? This ear looks bigger. This ear looks smaller. It's rotation. Look here. Okay? And if we compare that to the film, you see what I'm showing? Do that again, please.
March.
March, please. She has a lot of compensation right now. Stop marching. Keep nodding. Stop. Look straight. What do we see? Okay. Do you see, if I do here, which one is higher? This one is higher now, right? Right side is higher. And if I touch here on the right, tender or there?
There.
Okay. Have a seat, please. Cool. Dude, she's an enigma, dude.
That's why I like to start.
Let's do it. Let's get to work. Starting at the base of the neck. Let's run the meter. Aya caramba, 20 points. Left side. 15 points. 18 points. Left side. 15 points. Left side. I'm about to trip you all out in a minute. Show. Mira. She has cord pressure all the way down to, try that again, just to make sure. Slow it down. Nope, never mind. Told you she's an enigma, dude. T7, left side. It's all personal stuff, dude. It's not work. Yeah. 11. It's down in the low. Right sacrum. S3, S4, T11. T11, T7. 4 didn't show up. I'm sure it's going to show up later at some point. And upper cervical. Now, what's a little confusing to me is it's kind of switching each time. When I was telling you inflection, this thing don't open up. Look, it's stuck.
Yeah.
You feel that?
Mm-hmm.
Tender?
Yeah.
Tender again on the right or the left?
The left.
Okay. Okay, let's do static palpation. Round your back slowly, please. Good. Let's run our fingers down the spine. Tender.
Mm-hmm.
That one or that one?
Yeah, second one. Yep.
1, 2, 3, 4, 5, 6, or 7.
6.
That's the stomach. 7, 8, 9, 10, 11. Or 12.
11.
11. The B button. Alright.
I'm sweaty.
I haven't even done
so
anything,
nervous.
Nothing to be nervous about. Just be excited about
I am so excited.
figuring out this stuff.
I've been rephrasing everything that I'm excited and I'm not nervous.
Look.
Is it that much swelling?
Look,
It's pretty crazy,
can you
actually.
tell her? And you'll see it
It's
on the
puffy,
video.
it's
Yeah,
puffy,
it's very
yeah.
puffy. For you and your size,
Yeah.
it's very
Yeah.
puffy.
Oh.
Back slowly towards me, please. Number 5. Number 1. Number 2. Number 3. Right there. 4. More tender there or there?
The first one.
That's S4. That's in the logo. Okay. Top of the joint, middle of the joint, bottom of the joint. Tender?
Yeah, the last one.
Bottom of the joint.
Yeah.
Top of the joint. Top of the joint. Look, and this is inflammation, okay?
Mm-hmm.
Sorry I had to do that.
No, I.
Like, why did he pinch me? Top of the joint, middle of the joint, bottom of the joint. Both bottoms?
This one was more.
Right side was more. Okay. Ah, fun times, dude.
Should we
Stand
switching
up.
from left to right on everything?
What's that?
It's like switching from left to right on everything.
Everything is left-sided in the spine, but right on the hip. So I gotta take a look and see what we're gonna do. Because the last thing we're gonna do is that TMJ, okay?
Okay.
That's not even a
Work up to it.
What's that?
I'm gonna work up to it.
Yeah, we gotta work on her foundation first. That's AS ilium with the rotated sacrum. All right, vamos, come here. Let's talk about it. Let's talk about it. So it was on the bottom of the joint. Bottom of the joint is more the AS ilium. So when it goes up, you're feeling it on the bottom of the joint. When it misaligns down, you're feeling it on the top. You did feel a little bit on the, but you felt it on the bottom there too. So right SI joint. Now we got one more test to determine, are we going to do pelvis or sacrum? I know we got to do the sacrum, but so that we can explain to people and they understand.
All right.
Okay, what you're going to do, you got makeup on, right?
Yeah.
Someone just messed up all my tables with makeup. Come here. That's all right. So what you're going to do, you can, I want your face down, feet on the edge of the table, slide down. So you can see. Okay, so we're talking about right SI joint. So you can come closer and let's see. You can tell me. If we look at the legs, the feet, the right is slightly shorter. That would be a PI ilium. That doesn't make sense. She has an AS. Okay? Bend. Did it, so short on the right. If short stays short, sacrum. Short goes long, pelvis. Okay? Short. What happened? Stays short still. Sacrum. Okay? It's the Gonstead Leg Check. Okay, let's get started. Come on up. Walk it off, shake it off, and let me formulate your game plan for today. Walk it up. S4. Okay, so we're going to do right sacrum S4. You said anxiety, right?
Mm-hmm.
We're going to stay in the parasympathetic nervous system, penthouse and basement, down low and up top. I'm not trying to stimulate it.
Okay.
Otherwise, you're not going to like me. You're not going to like me. So let's start on S4, please. We're going to go left side down. Slide forward, please. Slide to the edge. So I'm really liking this new pelvic bench because it's contoured, and through the contour you can get closer to the patient.
Oh, nice.
And it's actually more comfortable.
Yeah.
1, 2, 3, 4. Longer, right. What?
That's
That's the easy part. I hope. S4. Make sure that ankle just hook the back there, please. Good. Good. Nice and easy there. That's a little baby. Let's go to the other side, please. Nope, over here. Stand up. Switch over here. Go right. Slide forward. There you go. Involve side down. Get a little more oomph. Involve side down. Pull. Push, pull. Come on up. Let's walk it off, please.
I felt that one. I went in the first.
Walk it off, please. Now, keep walking. Let's go on the Hylo over here. Slide up, please. There you go. All good. Look at that. That's the rest. Nice. Nice and clean. Okay. Come on. 1 second. Walk it off, walk it out, and then we're going to check the cervical. Cool?
Cool.
Have a seat. Let's continue. Now, I can be nice with you and take my time.
Okay. Whatever you think.
It's not what I think. It's what you can handle.
Okay.
Because look, it starts here.
Yeah.
You feel that?
Mm-hmm.
It's 2 on the left.
Yeah.
It's 1 on the right.
Mm-hmm.
But it's occiput on the left. And let's check it by nodding. We're going to nod the head. Hold on 1 second. Feet out straight, please. All the way out. Okay. And let's nod the head. Try to keep your shoulders back. We're just doing the head. And we're going to nod on the right side. We're going to nod on the... You hear that?
Mm-hmm.
You crack yourself?
I can't do my neck, but I like to do my wrists.
Okay. We're going to do C2, C1. C2 left. PL. And ASRA. ASRA, anterior, so it's gone this. ASRA. Let's do C2 first. Nice and easy there. Chin back. There we go. That's
So loud.
That's the whole run. Before I continue, open the jaw. Okay, close. AS, or you gotta be in front, turn in, and bring that elbow slightly down for her, just like that. Clonk. Walk it off once, please, or twice.
It's so loud.
Walk a straight line for me if you don't mind. What's different right now when you're walking? Anything?
I can't pinpoint it yet. I'm like, can I even speak?
Okay. Have a seat. Let's rescope and see what happens. So we found all those areas, right? Let's see what we find now. Starting at the base. Zero. Neck is clear. Four is clear for today. 11 is clear. No kidding. Why does he tilt the scope one way and it looks like he's not putting even pressure? It's because the spine is not even on that patient. There you go. All clear. Now we'll deal with the other stuff. Come back, check it out. Check it out. Good? Look, this is 5. S1, I'm pushing harder. S2, S3. You remember this?
Yeah, way less pain.
Top of the joint.
Way less pain.
Middle of the
no
joint.
Pain. No pain.
Bottom of the joint.
No pain.
Top of the joint. Middle of the joint.
Wait.
He's so jealous.
Of
Of the adjustment.
I've
No,
seriously
it's
been doing
crazy.
this whole time that I want to do
Yeah.
this.
Okay,
That's
sit
crazy.
back for me, please. Now the jaw.
That's so
Shoulders and jaw.
exciting. Yes.
Shoulders first. I'm saving the TMJ for the grand finale. Shoulders, AI. Over, around, down, over. That's it.
Wow. So easy.
Okay. Ears.
Ooh.
Alright.
Why did I love that?
What's
I
that?
need to learn how to do my ears.
The ears?
That
I'll
felt
teach
great.
you guys later.
That
Actually, I
felt
did a
great.
video and taught. It's just down and out. You're holding right there?
Yeah.
Down and out.
Oh
So
my
it's a
God.
scoop. Scoop.
I always massage them, but never just a quick movement.
Open. Left and right. It's left, right is the EX. That's what it is. So that's what we gotta go with.
Which one pops?
Right.
It compensates?
Yeah. So the pop is from a compensation, not the problem. The actual problem started on her left. Tell me.
Oh my god.
I've been
Call
thinking
him
about
out.
that the whole time.
What?
I've been thinking about that piece the whole time.
Mm.
Like childhood, or could it be just like if you felt like
She's saying she was since 7. She said she's anxiety since 7.
But I didn't know what to call it.
I understand that. Open. Close. Slowly open. Okay, open all the way. Okay. Conda block. Open all the way. Open. Close half. Hold. Right there. Hold. Don't move. It's crunchy. No, the muscle. That's that Botox they put
Yeah.
in.
Oh shoot.
If it's too much, you tell me, I'll stop.
Mm-hmm.
Open. Open. Slowly close. Gotta do it, dude. It's making me sweat. You okay?
Yeah.
Okay. Hold on. Right ear down, down. There's the rest. Open. I know it's clicking. Does it feel different though?
Uh-huh.
Slowly close. What's different?
It's not as harsh of a like it was a severe indentation feeling.
Just feeling, okay?
Mm-hmm.
Head back. Not so far, up a little. There it is. Again, if it's too much, you want him to hold your hand? There you go. Want me to stop? Say stop. There it is. Back, back, back. Right there. Come on, hold it up. Almost there.
It wasn't like a severe pain, it was just...
Did I hurt you?
Mm-mm.
Just in case. Just be around. Can I look on the other side now?
Mm-hmm. Thank you.
Go through more tissue than freaking face paper, dude. Okay. Open. This is all way before you do. Okay. She's angry. She's got anger. It's family. It's family anger. That's where it started. Then it went to the work. It started at home. Went to the work, and she's not saying what she needs to say to whoever it is she needs to say it in the family.
Oh my god.
Okay? You need to say it.
It's just like crazy how accurate you're being when we've been talking about it.
It's not Hollywood, dude. It's real.
It's really relevant to my life. I feel good though.
Can I do more?
Absolutely.
Yeah. And the reason you're not holding her during it, because it's not you.
Yeah.
So I don't want you to get it, dude, okay?
Yeah.
So you don't want it. Oh. We got half of it up. So whoever you need to let go and forgive. You have a brother?
No, 2 sisters.
2 sisters, older, younger.
Older.
That's it for today. That was a lot.
I can't handle it.
Open. Tell him. I know it pops, but it's different.
Uh-huh.
That's the bugger there.
Yep.
They killed the nerve going to the muscle. It's not functioning, dude. So we got to figure out how we're going to get that power on.
Mm-hmm.
Open, open, open. Close. Open all the way. Close. There you go. That's it. Okay. The trooper did. Did a keeper for you, dude, okay? Keeper. No returns. Dude, you got me sweating on this one. Oh, hold on, I gotta take my jacket off. I don't think they've ever seen me take my jacket off. Seriously, I'm sweating. It's because the AC's off. Okay. That's it for today.
Okay. That was a lot.
You did good.
That was great. Really.
I was going to do the nose, but I'm not doing it.
You can.
No, it's enough.
I have the capacity.
All right. Come on back. You sure?
I am sure.
All right. It's right there on the right. You feel that?
I have a crooked nose.
You have a slight... Look. This is the left side. Just stuck a tiny bit on that right side. There you go.
Wow.
That's it. Easy.
Wow.
Breathe in and out. Maxillary. There you go. Okay. Easy peasy.
Oh my gosh.
All good?
That was
Courtney?
life-changing. Truly, truly life-changing.
Buck it out.
Thank you so much.
You're welcome. So I can't describe what you went through.
Yeah.
Would you like to describe? Have a seat. Would you like to describe what you went through?
Right now?
Yeah.
About what?
Because the people are gonna be like, he's hurting her.
No,
What is it? What is it?
He wasn't causing me physical pain.
What was it?
I have stored trauma in my body that I didn't know how to release myself, and I needed assistance, and he just did that for me.
Okay.
It came out. I just,
You let it
it
out.
poured out, and that does not happen very often to me.
I know, because you have a big wall.
Yeah, I do.
So whatever you need to say to whoever you need to say, it started at home. And it started way back when.
That starts, yeah.
Okay, so if you can start working on that, start the forgiveness process.
That's work.
Okay, that's the hard work.
Mm-hmm.
It's actually not hard work, and I'm going to share one more thing. So forgiveness takes a moment. I forgive you, truly.
Mm-hmm.
But to get to that point can take an hour,
Mm-hmm.
or 10 years, or 50 years.
Mm-hmm.
And guess what stops the moment?
Me.
The ego,
Me.
the pain body.
Yeah.
Okay? So whenever you're ready to let it go
Mhm.
and say, it's time to move on, then it's time to move on.
It is.
Okay? Face it, don't run from it.
Thank you.
You're welcome. Can I work on your hands?
Yes.
Because since you're an artist, stand up. Squeeze. Squeeze. Elbow.
I love the wrist.
Lunate. Squeeze.
The wrist.
Lunate. Scaphoid. Squeeze. Squeeze. Welcome to the
Very
office.
nice. Thank you. Thank you so much. I'm so
Pleasure.
happy.